Hi, my name is Juliet Glass, and I am making a presentation on the curriculum I developed for an accelerated Baccalaureate of Science in Nursing program in partial fulfillment of the requirements of Nursing 575. My program type and model is an accelerated baccalaureate. Applicants will be required to have successfully completed a previous baccalaureate or master's degree program with a minimum of 3.0 GPA in their previous program. For those who do not have a science background or who have completed their program in more than 5 years ago, they will be required to take the following classes: Chemistry 1 and 2 with labs, Microbiology with lab, Anatomy and Physiology 1 and 2 with labs, Statistics, Human Growth and Development, or a Developmental Psychology class, as well as a Nutrition class. Program structure and delivery. So the program is structured into 9 blocks of 8-week quarters for a total of 16 months. The delivery method will be that of hybrid, which is 20% of online learning activities combined with traditional face-to-face class time. I read an article by Albana that talked about the flipped classroom model have shown to improve test scores. So the flipped classroom model just involves students completing online activities, learning activities prior to coming to the classroom, so that classroom time is spent doing higher level application of information as well as problem solving. The program also includes 750 clinical hours, which includes clinicals at facilities and lab simulations. We know that simulation in the lab is a sophisticated teaching method that enables the students to learn scenarios within a safe space. And then, of course, a senior clinical practicum. Program partnerships. I plan to program with the local colleges so that students can get those prerequisites offered in a timely method so that they can complete them. And then local hospital, state mental health hospital, the community health centers, as well as school health centers, so that students are able to pick up their clinical and practicum hours. I chose 4 different philosophies to help guide my curriculum: 2 traditional and 2 contemporary. So the traditional philosophy of progressivism includes growth of students as the center of educational activities. Our world is constantly changing, and students must learn to think in order to function successfully. Education is a lifelong process, and students must be actively engaged in experiences that build their emotional, mental, physical, spiritual, social, and cultural capacities. The second philosophy is that of pragmatism, which is a combination of realism and idealism through actively engaging in learning and hands-on learning. Learning outcomes are assessed through the examination and observation of students interacting with clients. The third philosophy is that of humanism, which is concerned with the rights, autonomy, and dignity of people. The faculty must view themselves as agents for social transformation, shapers of educational message, and processes that promote personal growth and social welfare. And then the final philosophy is that of multiculturalism, diversity, and inclusiveness. Multiculturalism is where individual differences are respected and celebrated. There are 4 main goals: to build tolerance of other cultures, to eliminate racism, to extend knowledge of cultures, and expand thinking view from different cultural perspectives. I use 3 learning theories to guide my program: the behavioral theory, which is basically learned behavior, cognitive theory, and cognitive apprenticeship. So behaviorist theory will be evident in the competency-based and skill developmental checklists used to guide the learning of students. Cognitive theory is restructuring of information processing, memory, and perception. And then cognitive apprenticeship is when students participate with experts to learn. Because this is a hybrid program, I included a digital theory of learning, pedagogy, in which people know how to learn and do so in a self-determined fashion and in response to complexity within the limits of their own knowledge. These students have already been through a degree program. They are able to recognize where limits in their knowledge is, and then it is expected that they will be able to search the resources in order to limit that gap. Educational framework and pedagogies, I chose andragogy, apprenticeship, and cognitive constructivism. Andragogy includes adults are self-directed, goal-oriented, and motivated to learn. Apprenticeship, through simulation and clinicals, the novice student will learn from expert nurses and their instructors. And then cognitive constructivism, knowledge is linked to previous knowledge and then transformed in response to new experiences. So I used a combination of core curriculum design, academic subject design, and fusion design for my organizational strategy. Core curriculum design includes subjects or topics that are required of all students. Academic subject design are nursing courses that recur in the curriculum with increasing complexity. And then fusion design are subjects that are combined to form a new content area, such as health promotion and contemporary nursing. The building block design is what I use for the construction of my knowledge. This involves clearly defined body of knowledge or skills is organized into a pyramid-like arrangement. So the base is a foundational knowledge course. The middle portion is specialized material. And then the apex is in-depth specialized knowledge. I use the traditional medical model also to help organize the curriculum. In this model, organization occurs according to disease, terms or vocabs, concept of nurse, and concept of patient. The content to be learned and how it is to be learned is identified. Nursing courses and skills are delineated. Non-nursing courses, critical learning experience, and evaluation methods are used to assess learning. And then the advantages of this model, which is primarily why I chose it, is because there's a wide availability of nursing textbooks. It allows for a good fit with the hospital organization and faculty members' areas of expertise. So when it came to determining the courses and how to sequence them, I looked up 4 different universities who already have accredited accelerated programs. I looked up Duke University, CSU Pueblo, Regis, and then NYU. And then the courses I selected from these different universities, I made sure that they cover the 9 essentials dictated by the American Association of Colleges of Nursing, Baccalaureate Education for Professional Nursing Practice guidelines. So Block 1, 2, and 3 are my foundation courses. Block 1 consists of Pathophysiology 1 and Pharmacology 1. Block 2 consists of Pathophysiology 2 and Pharmacology 2. Block 3 consists of Intro to Professional Nursing and Fundamentals of Nursing Care. Intro to Professional Nursing is just basically identifying the history of nursing and where the current role of nurses nursing practice is. And then the Fundamentals of Nursing Care, this is basically learning health assessment skills across the lifespan. And so this includes simulation and clinical competency. Block 4, 5, and 6, these are the specialized areas of my pyramid. So Block 4 consists of managing comprehensive health care of the adult and complex health care of the adult and older adult. So this is basically Med-Surg 1 and 2 with its associated simulation in class and clinical hours. Block 5 includes maternal and newborn nursing, and then nursing care of the infant, child, and adolescent. So again, this includes simulation and clinical hours for both courses. Block 6 includes gerontological nursing and mental health nursing. And again, there will be simulations in these courses as well as clinical hours. And then block 7, 8, and 9 is the apex of my pyramids. And so block 7 includes clinical reasoning, integration of theory and practice course, and this is basically our evidence-based research course. And then community and population-focused nursing, which includes clinical hours. And then block 8 includes contemporary issues in healthcare and informatics. With the rapid evolution of COVID, we all know the importance of telehealth. And so informatics will help to guide the students in developing and practicing telehealth effectively and within the scope of practice. And then contemporary issues in healthcare just will deal with disease prevention and promotion, with LGBT healthcare, global health issues, policy, ethical, and cultural diversity. The final block is clinical leadership and management of professional leadership, and the capstone practicum. So clinical leadership and management of professional leadership just helps to transform the student nurse into practicing in the real world, and then also how to integrate research into management of in the real world, and then of course a clinical capstone practicum. So student learning outcomes, we all know, are written statements about what the student's abilities will be upon graduation. So I've written 4 student learning outcomes. The first is graduates will be able to integrate current-based evidence practice, scientific knowledge, and critical nursing skills to provide the highest quality of patient-centered care. The second one is graduates will be able to efficiently integrate into interdisciplinary teams and assume management and leadership roles to improve the patient care and nursing practice. Graduates will be able to provide care that is professional and considerate of the cultural diversity and the needs of the community. Graduates will provide care that show their commitment, accountability, integrity, and integration of ethical practice in their delivery of care. This concludes my presentation. Here listed are references that I used to develop my presentation. Thank you all for your time.